Without treatment, gout will usually progress. In addition, certain factors may trigger gout flares. Anything that makes urate levels go suddenly up or down can set off gout, Dr. Fields says. Diet. This may include eating foods high in purines, which get broken down into urate, such as red meat and shellfish. Foods high in fructose can also increase the body's production of urate. Alcohol decreases the excretion of uric acid in urine, which can cause uric acid levels to increase. Specifically, beer not only has the effect of alcohol on uric acid in the urine, but also has protein that breaks down to purine and then urate, so it increases urate in two ways, Dr. Fields says. Although you may want to limit foods high in purines to prevent flares, both doctors we interviewed said that diet alone isn't enough to control gout. Strict dietary purine restriction is rarely recommended, as it lowers mean serum blood urate levels by only about 1 mg per deciliter, which isn't enough for most patients, Dr. Meysemi says. Gout was once called the disease of kings, but it was misunderstood to be simply caused by rich food and drink. Gout is a genetic disease, in which your body either puts too much urate into the urine or makes too much urate, and not a dietary disease, Dr. Fields says. Watching your diet can definitely help with gout flares, but to counteract a genetic tendency to gout you almost always need medication. So if you notice that certain foods bring on gout symptoms, avoid them. The consumption of alcoholic beverages or rich foods can trigger gout attacks in some patients, and the individual patient should avoid triggers known to cause attacks, Dr. Meysemi says. Obesity. However, one of the risk factors for gout is obesity. In fact, gout has become more prevalent recently, possibly due to rising levels of obesity. Weight loss in someone who is obese will have a greater urate-lowering effect than a purine-free diet, Dr. Meysemi says. To that end, a healthy diet and exercise can help you lose weight and reduce your chances of disease progression. Stress and injury. Emotional stress can also bring on a gout attack. So can physical trauma to the foot, such as might occur during running, which may release some crystals and cause an inflammatory reaction. We don't discourage people with gout from running or other exercise, Dr. Fields says. But if someone has a gout flare in the foot, ankle, or knee, we suggest they stay off the foot as much as possible, since further trauma to a joint with a gout flare can prolong the flare. Starting a treatment regimen can also unintentionally set off a flare, but other medications can also be given to help mediate this risk.